Good evening. My name is Michael Frost, Director of Marketing and Communications with Rock Hill Schools, and I'd like to first welcome you to tonight's Parent Academy session as part of our series, Navigating the Pandemic. I will have the privilege now of introducing Executive Director of Exceptional Student Education, Dr. Nancy Turner, who will share a little bit more about our Parent Academy sessions, as well as introduce our guest speaker for the evening.
Thank you, Michael.
Dr. Turner.
Thank you. And good evening, Rock Hill. Welcome to our second Parent Academy. And we are live stream and ready to go. Rock Hill Schools, in partnership with Keystone Substance Abuse Services and other community partners, is excited to continue our Parent Academy this week with a focus on substance abuse issues. Our Parent Academy session, Navigating the Pandemic, Youth Drug Trends Disguised in Plain Sight, will be led by Keystone Substance Abuse Service Prevention Director, Alex Greenewalt. Ms. Greenewalt is Prevention Director at Keystone Substance Abuse Services in Rock Hill. She is the Alcohol Enforcement Team Coordinator for York County. She received her Bachelor of Science in Public Health at the College of Charleston and an MBA in Healthcare Management from Western Governors University. Alexandra serves on the board of the South Carolina Association of Prevention Professionals and Advocates. She is a certified Senior Prevention Specialist. Additionally, she serves on York County All On Board Coalition to cultivate a drug-free community. Alexandra prides herself in leading the change in complex public health issues associated with addiction and improving the quality of life in the community through prevention efforts. Please welcome Ms. Alex Greenewalt.
Thank you, Dr. Turner, and hello, a warm welcome virtually to my Rock Hill School District friends and family. I'm so glad you guys can tune in today and hear a little bit more about what's going on with our youth drug trends and concealment patterns within our community and what we're just seeing amongst our youth. So I'm excited to share with you tonight talking about all the different trend categories from alcohol, vapes, marijuana, prescription pills, and just our over-the-counter medications. I'm going to kick it off and just go ahead and share right off the bat with you a little bit more about Keystone Substance Abuse Services. We're right here in your neighborhood in Rock Hill, South Carolina, and we serve regardless of the ability to pay. That's something that we pride ourselves in, because at the end of the day, we're trying to save lives. We have an inpatient withdrawal management detoxification facility. We also offer day treatment and intensive outpatient. We have gender-specific groups, which were very unique across the state of South Carolina. Not other treatment centers can offer some of these services that we have. We have outpatient, and then my very own, our prevention services. We do a lot of work within the Rock Hill schools, specifically with our 6th grade students. And I'll talk to you a little bit later, why 6th graders? Why not the high school? Why not a different age group? There's something specific with our 6th graders. And then we do a lot of community-based work throughout the community. Additionally, we have our walk-in assessments. Currently, because of COVID, we encourage you call ahead. We are offering telehealth and virtual services, and we are still offering our ADSAT program, which is for DUI, driving under the influence program. We have 3 buildings in Rock Hill, South Carolina, all located within walking distance of each other. Our main office is right across from Piedmont Hospital, but their emergency entrance, and that's on Herlong. We have a brand new, fairly new youth facility, and that is also right across the street from Piedmont Hospital. And then my prevention department is right around the corner on Ebenezer Road. I encourage you guys, please go like and follow us on our social media channels. What I'm sharing with you today is shared every day on our social media. We're always updating our community around what's trending, things to be alert and look out for, and just some great resources to have on hand. So please go ahead. You can follow us on Instagram, Twitter, and Facebook. One thing I'll plug, and I won't talk too much on this, but before we get going and talking about drug trends, it can kind of be a heavy topic, and sometimes people don't know where to turn to for help or what they can do. And some of you might be sitting on this presentation tonight thinking you might have your own child or a child's friend that might be struggling right now with substance use. They might not be to a point where you feel like they need treatment services, but there's still options for them, and we offer intervention services. So I like to put some optimistic hope out there before we start to talk about what's trending when it comes to drugs. So I'll be glad to kind of re-highlight this later, but we do offer 6 online intervention services around alcohol, nicotine addiction, marijuana use, other drugs. Also, we offer behavioral health interventions if you're experiencing any type of respect or resolve, or more so disrespect within the household, and conflict resolutions. If there's anybody on here that's interested in having me come and speak to your business, your classroom, or any other organization, church within the community, we offer a slew of presentation services to try to fit your needs. So why don't we go ahead and kick it off tonight with the alcohol trends? And I think it's so important to share something that is currently trending right now in the nation. And so I'm going to share a little thing that Keystone posted today on our Facebook page. It says, "Will your politician win? Will your politician lose? Either way, don't handle it with booze." And I think that's a good intro into our alcohol section, because even though we're talking about youth trends, this is something that as adults we can also kind of take and learn what are the risks and what are the things with our legal substances. There's still risk and consequences, as well as the illegal substances. So as you can see here with our Keystone Times, alcohol is still the #1 abused substance among our youth in York County and across the country. It's important to know what it is that is causing them to drink, what are the trends that we're seeing, what are the consequences that are leading to this. So we're going to dig right on in. And I want to share with you a survey that we did a year ago, back in the fall of 2019, across all York County. So this isn't just in Rock Hill, but across all York County. We surveyed 7th, 9th, and 11th graders asking, in the past 30 days, have you used alcohol? And you can see there that from 2017 to 2019, we offer this survey every 2 years. We went in the red zone. We went up. We're seeing 7th graders are starting to report almost double that they were using alcohol. 9th graders went up slightly, and our 11th graders went up slightly. So it's something to keep on the horizon and think about. And these are conversations that we always encourage parents to talk early, talk often. It's never too early to start having some basic conversations around substance abuse and what your expectations and rules are within a household setting. So when we talk about drinks and we think about what youth are or aren't doing, it's important to understand what a standard drink is. And to be honest, standard drinks really don't exist in our society anymore. When you go to restaurants and you're of age and you order a glass of wine or a mixed drink, it's very rare that you're seeing the bartenders or the waiters and waitresses pouring the standard drink size. And so down below, you can kind of see 12-ounce beer is a standard beer. You've got 8 ounce for a malt liquor, 5 ounce for wine, and then 1.5 ounces for a shot, a liquor distilled spirit. But let me show you what is considered not a standard drink. And this is more so what our society is seeing and what our youth are more prone to use when it comes to alcohol products. All of these on here are basically what we consider alco pops. It's a category of an alcohol, and it's based off of between a liquor substance, an alco pop, wine. Alco pops tend to be a little bit more fruitier, and they're usually targeted toward the younger audiences. If you look on here, you'll see a slew of different products, from a popsicle. One popsicle by the company Snowbar is equivalent to 1 cocktail. You also have Mad Dog. You have prepackaged frozen margarita mixed drinks. And then you have a lot of products on here that look very similar to products that we've seen. And if you look at the top, that Smirnoff Ice almost looks like Gatorade. These companies through the alcohol industry know how to target and market their products to the younger audience. The younger they can get them addicted and hooked to their products, the lifetime customers and more money that they're going to make. I want to talk though specifically about some of these drinks, and we're going to talk about Four Loko. And I actually have an example of one here. Four Loko is an alco pop, and it's actually 12% alcohol by volume. A standard beer, such as a Bud Light, is about 4.5% alcohol by volume. There are about 3 cans of Bud Light and this 1 can of Four Loko. And if you see on the screen here, one of these Four Lokos is equivalent to 4.7 shots of 80 proof vodka, or 4.7 bottles of beer, or 4.7 glasses of wine. And the scary thing is that this is what we're seeing in what we call binge drinking in a can or binge drinking in a bottle. When you look back at the screen, these are the products that our youth are more likely to use. They taste good. Our youth are not going to go for a high quality Chardonnay. They're going to look for a fruity flavored drink that can get them that buzz or that drunk and that has a high alcohol by volume percent. Now, as we move out of talking about some of those products, I want to show you some concealment products. And I think it's so important to stress that what I'm about to show you, these products were purchased here in York County. They are through our mall, and they are also through alcohol outlets, any retail establishment that sells alcohol. And the first thing I want to show is concealment flask. So this right here is a hairbrush. It looks like the exact hairbrush I would probably use. You can't tell anything's weird about it, but actually at the end here, the cap screws off and it becomes a flask to store any type of alcohol. It could also store any type of prescription pills as well. Some other common flasks that we've seen often sold online and also in our community. This is a tampon in a sleeve that says tampon. It looks like the name brand, and inside of that is a little test tube where somebody could store one little shot of liquor or a sip of a drink from that test tube. Another thing to show, this is something that you might see dangling off of somebody's book bag on a rainy day. And this right here just looks like a proud American umbrella, but actually it's a flask. If you screw the top off, this is where they're able to store liquids in. The last one I wanted to share with you guys, and this one was actually confiscated from one of our schools. Not going to say where, but it looks like your sunscreen bottle, something that you would see on the beach, at the pool, at an athletic facility, by Hawaiian Islands. It looks identical, and I'll get a little closer here. It says sunscreen lotion, and if you unscrew it, it's actually a little bit bigger of a hole, and this is where they're able to easily store any type of liquid product. Now, these are just a few examples of thousands of more. Google exists, unfortunately, and anybody can create their own, but it's something that I wanted to share that these were bought here in York County. And so it's so important from the parent aspect to always be aware of what's going on and looking for signs and patterns and behaviors with your youth. And I'm going to share some of those that are all encompassing as we get toward the end of our presentation. But one thing I did want to note is when we talk about alcohol in general, there's a lot of misconception around, is it safer for parents to supply alcohol for their kids if it's under their roof and under their terms? Meaning, if I were to host a party of kids and I say, I'm going to take your keys, there's not going to be any drinking and driving. If you're going to drink under my roof, I'll supply the alcohol and you're going to stay here. Is that really safer? Well, as research comes over and over and over repetitively saying that really at the end of the day, it's actually encouraging binge drinking and it's increasing symptoms of alcohol use disorder, essentially alcoholism. And if you think about through our research, as we see those that aren't getting supplied alcohol from their parents, maybe it's a friend that's a resource, a family member, a cousin, whoever it may be, there's still similar patterns of binge drinking There's still signs of an alcohol use disorder. So at the end of the day, that's a misconception that it's safer to do it under your roof, your terms, because you're creating a false sense of reality under your roof. Because when somebody becomes of age and chooses, if they make that choice, responsibly drink, when they're taught patterns of binge drinking behavior early on, their friends are all using it, whoever it may be, with the peer pressure. The reality of it is everybody gets different situations that they have to process, think through the pros and the cons. And sometimes what we're seeing with the parents supplying at home, it's just creating a false sense of reality. So I wanted to share that with you guys. Now we're actually going to move into what we're seeing as a big youth pandemic. We talk about the COVID pandemic. We're going to talk about the opioid and prescription pill epidemic. But I think vaping across the world is a pandemic for youth right now. So if you can kind of see here, and I'll read it out loud because it is fine print, e-cigs and vapes are very popular within our society. It was generally intended to help wean heavy nicotine users, whether they're heavy cigarette smokers, to wean them off of their levels of nicotine use. However, we know that these products have now gotten into the hands of our youth, into our kids, and they're being marketed really to our youth. So I want to share with you, what are these popular products that we're seeing? What are some concerns? And let's talk about the nicotine levels. But I also wanted to share with you what we're seeing right here in York County. And when we asked our 7th, 9th, and 11th graders in the past 30 days, have you used traditional tobacco? And have you used e-cigs such as a Juul or a vape? And you can kind of see that we saw a decline across the board with traditional tobacco cigarettes. That's going to be your cigarettes, your dip. A lot of that has gone down, which is good. It's in the green zone for 2019. When we look at e-cigs and vape, there's been a significant decline over the past year or so. And there's so many efforts happening with our teachers in the health education classes. They're really getting these messages to our kids about the risk, the addiction to the nicotine. But we still see with the 7th graders, there wasn't much of a decline when it comes to vaping use. So something to keep in mind. Now, as we talk about what are the popular products out here for our youth, I really want to share with you first just a basic understanding that 1 pack of cigarettes is equivalent to 20 milligrams of nicotine. Now, as we move to the next one here, 1 Juul pod, and a little pod is what contains the nicotine, and it gets popped into these electronic devices that the kids are able to use. And once that pod is depleted, they pop in a new pod. And each pod has roughly 41.3 milligrams of nicotine. So if you look at the difference between 1 Juul pod and just a traditional pack of cigarettes, a youth that goes through 1 pod a day is basically inhaling 2 packs of cigarettes. Now, Juuls are outdated. They're old school. And now the next product on the market that our youth are using is something called puff bars. And puff bars are a disposable vape. And I'm going to share a little bit more about what a disposable vape is in the next slide. But if you look at 1 puff bar, it's equivalent to about 50 milligrams of nicotine. It jumps almost 10 milligrams more than your traditional Juul pod. And the last one on there is what we call a Sorin pod. It's a little bit of a thicker device. It's fatter. It's not as slender as a puff bar or a Juul, and that is equivalent to over 90 cigarettes. Now, each youth is different, whether they're having a hit, just a quick inhalation of the puff bar, the Sorin pod, the Juul, or there's others that are inhaling it all day long. So these are conversations that the basic knowledge around what are you inhaling, you know how much nicotine is in there, is what I encourage parents to be educated so that you can have these conversations with your youth. This is data that just came out for 2019 with our Youth Risk Behavioral Surveillance Survey, and now we're seeing 1 in 3 high schoolers currently vape. So we know it's an epidemic with our youth. Like I keep saying, I believe it's a pandemic with our youth across the world, and it's something that we have a lot more resources for. And that's why we're seeing rates decline, but we still have a lot of work to do with our high schoolers. So let's kind of look here at what are these popular ones. I talked about this puff bar, and right now these puff bars are just taking storm on the market. There's a lot of legal backlash happening on the federal level to get puff bar removed from the market. They have studies that are showing these products and marketing campaigns are really targeting youth. The tobacco companies and vape companies are paying for advertisements to show up on TikTok, on Instagram, and youth-friendly social media accounts. So we know that they're trying to get our youth addicted, and unfortunately it's working when it comes to a lot of these right here: Puff Bar, Nick Bar, and Super Good Bar. They come in a wide range of flavors, and why they're legal right now is because they are classified as a disposable vape. It's a one-time use. You can't refill it with a liquid. You cannot fill it with a new pod. It's one-time use and thrown away. And because our language across the federal level when it comes to tobacco products for youth 21 and younger, because right now that is our new federal law, 21 and younger, you cannot, or excuse me, anyone under the age of 21 cannot buy, possess any type of tobacco products. And what we're still seeing is these products that have flavors like the jewel pods, cream brulee, mango, those really no longer exist in our convenience stores, Walmart, your basic stores that are selling these products, but these disposable vapes are taking their place. So just something to be aware of and what to look out for. And in fact, when I say what to look out for, you have to know what's the aftermath here. What are the concerns that we're seeing with these vape products? And I put at the very top, it's so important right now more than ever to talk about COVID exposure being increased for anybody that smokes. This is across the board for adults and youth. If you're using any type of nicotine or cannabis vape or tobacco product, you're putting your lungs and your immune system at risk. You're compromising them, especially right now through our pandemic with COVID. Some other concerns that we're seeing, I hear it day in and day out with nicotine poisoning. For the devices that require the nicotine to be manually refilled into the device, so it's not a pod or anything like that, if that juice gets splashed onto the skin or it gets tipped over and your skin touches it, it gets absorbed into the membranes and goes straight into the blood. And just as we hear things such as alcohol poisoning, that is having too much alcohol within the bloodstream. Same thing happens with nicotine poisoning. I've heard countless middle school, elementary school students, and high school students hospitalized in the ER due to nicotine poisoning. You can also get nicotine poisoning from inhaling for too long and too much. The other thing that we hear about occasionally in the news or just through social media is the explosion of these devices. Just like anything, if it heats up or if it's manufactured incorrectly, these devices can pose a risk and cause an explosion. And we've had multiple cases of death linked to explosions over the years. At the bottom right-hand corner, I'm not going to get into this in too much detail, but before there was a huge COVID pandemic, we saw across the nation something called epidemic across the United States. And it was e-cigarette or vaping illnesses with the lungs. And we are seeing young people across all age groups getting hospitalized and death related to some type of lung illness. And we're going to talk a little bit more what the majority of these products were linked to. And it's more so on the cannabis side of the cannabis vapes, but we still have seen countless cases of something called popcorn lung and ARDS. And ARDS is acute respiratory distress syndrome. It's something that happens generally in our geriatric population as the immune system gets weakened over time. The lungs are working harder, the body and the organs are working harder at that age. That's something that's more prone for that age group to develop ARDS. But we're starting to see ARDS happen amongst our young youth, and it's being linked back to these vape products and the chemicals that are in it. And last but not least with the concerns is vaping addiction. That's something that's probably the most number one thing I get called each week from a parent that's concerned that their youth, they think, is using vapes or maybe even using traditional cigarettes. They're concerned or they feel like they're addicted. And the good news is Keystone Prevention has a resource for you. We have a Nicotine 101 online self-paced intervention, and it actually creates a cessation quit plan for that individual based off of what they identify as they work through this program. And it's a great resource to help reinforce positive activities, such as finding a new hobby, replacing a bad habit with some type of positive reinforcement. And that's something that this program and intervention really emphasizes. If you're interested, please reach out. I'll have my contact information on here at the very end. Now, this next one, I'm going to take a pause because I want to ask you guys that are watching right now, when you look at this picture, are you able to identify the vapes in this picture? So I'm going to take a moment and let you really look and see if you can find the vapes. As you're looking through this image, it looks like a traditional desk, something that all of our students that are going through virtual academy right now probably have. They have their stapler, their pens, their colored pencils, everything. And as you look at this from a parent perspective, nothing's really standing out. But if you look a little bit deeper, you can see here the pod is sitting in that little container right in front of the Germex. A vape is sitting right next to that flash drive in the bottom. Right there where it points from the tape dispenser over, that's a Juul that looks so much like a flash drive and just blends in with technology. You've got another vape device that almost looks like a highlighter, that yellow, yellow little device. And then the hidden ones that are in the pen and pencil container. There's a vape hidden back there, and there's a little skinny e-cigarette that looks like a pen. This is why it's so important from a parent perspective, being aware of your child's environment, asking questions, having conversations. Don't be afraid to ask things, and don't be afraid to surveillance your child's space, their room, their cars, places where they might feel like you're not checking their drawers. You might not be checking their bathrooms. There's obviously a boundary limits when it comes to certain things, and I'd be glad to talk about that a little bit more once we get to the end. But it's something that we always encourage parents: talk early, talk often, and monitor, and set boundaries. Set boundaries is a big one. All right, so we're plugging along here and we're moving into the marijuana section. Now, these last two sections are a little bit longer. We've been moving fast because there's a lot to talk about, but when it comes to marijuana, there's a lot to talk about. And if anyone's keeping up with the nation, things are changing by the day, and that's why it's so important to stay educated. It might be hard to stay up with day-to-day trends, but at least knowing the basics when it comes to marijuana and what is impacting our youth. And one thing that I always say when it comes to marijuana, that it doesn't matter what state you live in, whether medical marijuana is legal, recreational marijuana is legal, or it's illegal. At the end of the day, any substance across the board, from nicotine, alcohol, marijuana, prescription pills, meth, heroin, it doesn't matter what substance it is, it's having an impact on that child's developing brain. And we really have so much research to support that earlier on in the younger years, the habits that are developed eventually becomes dependencies, which are addictions. There's cycles of repetitive negative habits. And that's something that we're going to talk about. And it's a good conversation topic to have with our youth, to remind them, no matter what they're seeing in this world, even though alcohol is legal, there's still risk and consequences that come with it. Drinking and driving, losing a scholarship. Same thing with vapes. I get a lot of referrals from our school resource officers. That's a consequence. That could be a consequence of the coach benches your child because they got caught smoking or vaping. When it comes to marijuana, we'll talk a little bit more too about what we're seeing with these consequences. So I chose this picture strategically because when we think about marijuana as a whole, I think a lot of people kind of, and parents specifically, think about their traditional flowering bud of marijuana. And a traditional flowering bud is that image in the bottom right-hand corner. That is a flowering bud of marijuana that contains THC. But the reality of the marijuana industry these days, it's far beyond the traditional flowering bud. And it's more so these edibles and these marijuana vapes that the cannabis industry is creating and tailoring all these new products day by day. So I want to keep you guys a little bit in the loops of what are the ones that we have some concerns about. So we're going to jump right into, once again, what is our youth saying around marijuana use? And besides alcohol, slightly increasing with our youth from 2017 to 2019, across the board from 7th, 9th, and 11th grade, marijuana has increased with those that are reporting using it. And this is something that we're seeing statewide. It's not just here in York County, it's national. And once again, it goes to what are our kids growing up in our society. If you think back to your years of high school growing up, these advertisements and commercials and TV shows and music didn't quite emphasize what these kids are really hearing and seeing day in and day out. So we'll talk about that. But once again, no matter what, whether it's any substance, marijuana still impacts that developing brain. And I put this slide in here. This comes from a really popular presentation that I do in the community. And it's a full presentation on marijuana, just the facts, just the education. I'm not here to persuade anybody from one side to the next, but just to give them the basic understanding of what's going on in these products. And nowadays, the common THC oils and concentrates, which are in the bottom left-hand corner, these are called THC concentrates, and slang terms such as shatter, wax, resin, keef, butter, crumble, hash oil, honey oil, all of these different names are basically what they're referring to as high potency levels of THC, ranging from anywhere from 60% upwards to 90% THC. And if you think about a traditional flowering bud of marijuana in our modern day society, a traditional flowering bud of marijuana starts at 15%. But look at that statement underneath of that. Back in the hippie and the Woodstock era, some of you on here, you may have grown up in the 70s and you may have realized and seen and experienced for yourself what the marijuana was back in the day. And I want to really emphasize that the marijuana back in the 60s and 70s and long before what we're seeing now was only 2 to 5% THC. And we call that in the prevention world giggle pot. It brought them a little bit of the munchies, a little bit of the laughter, and minimal consequences. 2 and 5% THC, you weren't seeing much addiction happening with cannabis and with the THC. But it's a whole new world right now when it comes to the THC and marijuana industry. So I want to kind of talk you through some of these pictures here on the slide. In the top left-hand corner, this is an example of a dab. And a dab is a high concentrated hit of THC, and it's using a concentrate, which is one of those waxy forms of marijuana. And it goes into a vape device and it's inhaled like any other type of traditional vape. Generally, a lot of the times I get the question from parents or audience members, can you smell it if it's in a vape? You can smell it. There's a lot of different products out there that can mask the smell of marijuana. For example, this is a product that I purchased from one of our local vape shops in York County. And I'm going to get a little closer so that you can see it. It's called Smoke Buddy. And it's a little plastic device that somebody can blow the smoke into one end and it filters out on the other end the smell. There's products like this out here to really disguise the smell. But ultimately, at the end of the day, these vape products still have that traditional marijuana scent to it, which we always like to reference more so of the skunk smell. In the top middle picture, these are examples of pre-packaged THC vapes, and we call them pods or carts. A cart is a little twist that gets twisted on top of a vape pen. For example, this right here has a cart that twists on and off. This vape pen, when it's empty, gets untwisted and a new cart gets put on. These are products that are commonly found in legal states and dispensaries, but they're also commonly found through the black market here in York County and across the nation. And we'll talk about in the next slide about the black market and what we're seeing happening. And the next right-hand picture there, I'm not here to teach you how to do this, but I want you guys to know that there are so many ways that we're seeing kids get creative by refilling these carts and these pods on their own. And it gets dangerous because they're now handling these substances. They don't know what they're putting into it, and ultimately they're inhaling it into their lungs. Bottom right-hand picture is a traditional old school dab. It's a device that's used to heat the THC at a very high concentrated hit. And something when we talk about these dabs, the equivalent of a dab is basically vaping alcohol. It's uncommon to vape alcohol, but if somebody were to vape alcohol, it instantly goes straight to the bloodstream and the body goes from 0 to 100. It's an instant drunk, impaired state of mind. Whereas when somebody's able to control the amount of sips that they're having, they're able to kind of feel their body go through the states of intoxication. But when you vape alcohol, there's no going through those stages of intoxication, the tipsy, the drunk. It's extreme intoxication that can lead to alcohol poisoning, and we've seen countless deaths happen with that. Same equivalence when we talk about these dabs. It's going from 0 to 100. The body is instantly high, and there's a lot of concerns when we think about these dabs because our young kids and even adults, their bodies go through some type of shock. Sometimes it's respiratory distress. Sometimes it's increased panic attacks, paranoia, hallucination. And our body has something called an endocannabinoid system. And our endocannabinoid receptors throughout our brain and our body are all individualized. Every single person is different, just like our genetics. And that's what we see with marijuana. It's not a one size fits all. So if a child has a friend that's using marijuana to help with their anxiety, and that child's friend says, hey, try it, it'll help your anxiety. That's not always the case because once again, it's not a one size fits all. Everybody is affected differently with the marijuana products. So I'm going to pause here and I ask you guys to take a moment and look at this screen. Can you as parents identify, or grandparents or caregivers, can you identify which vape is nicotine and which vape contains a THC? It's so hard to tell, and I'm sure it's hard for you to tell right now on this presentation. But on the left hand there, that is a THC vape. In the middle, that is a THC vape, and on the right, that is a Juul, and that is a nicotine vape. It just goes to show that the big tobacco and big marijuana industry copy each other. They have similar products, and ultimately, at the end of the day, these products are getting into the hands of our youth. What we're seeing right now, especially here in York County, are a lot of black marketed, what we call bootlegged THC vapes. I've had the coroner's office send me pictures of the exotic carts in the bottom right-hand corner at the scene of a death investigation. I've had so many patients here at Keystone that are going through our services, trying to get into their recovery, share with me that these products, they've seen them in our community. And if you look at them, they're marketed so cleverly and most likely to our kids. You see Sour Diesel in the left corner there, Fruity Pebbles. These are cartoons that our kids are growing up seeing, and the flavors are very enticing. So why there's concerns with these specific products, exotic carts, Kingpen, Chronic, and Dank, these products are coming from the black market, and these are the ones that are being tainted with vitamin E acetate. And what vitamin E acetate is It's a chemical, an oil that's generally found in topical lotions, and it's something that is common in dietary supplements. But what it's not been common over the past year or two is being put into vape liquids. We've never seen cases before of people inhaling a vitamin E acetate until these past few years, when all of these bootlegged black market THC vapes started trending and flooding the markets into all these communities. And these products right here on the screen have been tested by our DEA, and our FDA have put out warning statements warning anybody that's using any type of marijuana product to stay clear of these, because they are found to have the vitamin E acetate. And what this vitamin E acetate is contributing to are those lung illnesses. I shared with you the EVALI lung illnesses such as ARDS, popcorn lung. These are more commonly found with people that are smoking or vaping these marijuana devices. So once again, being aware, being educated, you're able to at least have some healthy conversations to prevent the onset of use. The other thing to be concerned about are edibles. I call this slide the Betty Crocker of edibles. If you look at the top right-hand corner there, it looks like something out of Martha Stewart's kitchen with Snoop Dogg. If anyone follows that show, this is what it looks like, and this is what they do. They're extracting something called canna butter, which is just THC being put into a butter form. In fact, I have an example of one that was purchased at a vape shop in York County. This product is called Easy Butter. And it looks like a metal canister. And what it does is it extracts from the flowering bud of the marijuana, the THC oil, then be incorporated into some type of edible product, whether it's the butter, the cookie dough, the brownie, a liquid drink. Pretty much you can put THC into anything. And here's why there's a lot of concerns when we talk about edibles. If you think about alcohol, once again, I said our youth are not likely to pick up a nice glass of Merlot, Chardonnay, or a quality mixed drink at the least. They're more likely to go for those fruitier, high alcohol by volume, such as a Four Loko. And when we think about marijuana products, edibles like cookies and brownies are more enticing for youth who might not want to smoke a traditional form of marijuana, whether it's a vape or smoking it. So edibles, one thing to note, they're unregulated. Marijuana is still classified by the DEA as a Schedule I drug, right up there with heroin, peyote, and other narcotics. And what a Schedule I drug means is the FDA does not regulate any form of Schedule I drugs. And that poses a risk because at the end of the day, these products are being sold legally in dispensaries, and they're also being sold illegally through the black market, and they're coming into our communities. And what we don't know is what is being put into these products. So they're unregulated. A general dosage, like a serving size, if we think about food, a serving size of a cookie that contains THC is 1/10 milligram. 1/10 of a cookie. If you look in the bottom right-hand corner there, that's just a small basic cookie. Think about 1/10 of that cookie is one serving size to get one person high. That's not what we're seeing happening with our youth across the nation. Here in our communities, our youth are consuming the whole cookie. They're consuming the whole brownie. They're consuming the whole bag of gummy bears and goldfish. And that's causing an increased chance of, once again, hallucinations, paranoia, increased anxiety attacks. And it also is showing signs of increased risk of suicide, because when the body is in that panic state of paranoia and hallucinations, we've seen countless situations across the nation where there's been death by suicide. So I get the question all the time, can you overdose on marijuana and can you die as a result of using marijuana? The answer is yes to both of those. You can overdose and have a non-fatal overdose of marijuana, meaning your body is just way too high. Alcohol poisoning is the same thing as a alcohol non-fatal overdose. You get emergency medical care. It's not fatal, but your body went through extreme shock, unconsciousness. Same thing happens with prescription pills. We have fatal and non-fatal overdoses. Same thing with meth and heroin. And we have the same thing with marijuana products. And we see so many youth right now, especially from our high school and college age population, when they get into that curiosity phase, are starting to show up in the ER hospitals. We've seen so many come through our doors here at Keystone, and I want to share it with you guys that these edible products are very potent, and a lot of times these kids do not know what they're consuming. So concealment products, show and tell time. I want to show you some other products that have been purchased here in York County. And this right here is an example of a marijuana THC vape. It's a brand called Sutra. And this is the box for it. And I'm going to show you the little device here. It's kind of a little bit fatter. It's not your traditional slendering device, but it's something that can fit in the palm of my hand and I can inhale it. And you really, from a parent or a distance here, would not be able to tell what this is in my hand that I'm inhaling. This Sutra device can use an oil form of THC or heat up a flowering bud, which is a concern because at the end of the day, a lot of people don't know, is this a nicotine vape or is this a marijuana vape? But it's so common that these products out here are so interchangeable and they look identical to the nicotine vape. I shared with you this earlier. This right here is a dab pen. It's a cart that contained the THC oil. And this was confiscated from one of our school resource officers. He got it from a student from our schools here in York County. This dab pen, like I said, contains the high potent THC oil. Another thing to be on the lookout for concealment things, any type of rubber, a little tiny rubber container, this opens up. It almost looks like a chapstick container, something you would rub for chapstick, but it's rubber. These silicone rubbers are able to kind of mask the smell of the skunky THC that many people recognize. So this is something that we always say, be on the lookout for. Anything that you see that has the Rasta colors generally could be linked to the marijuana culture. The word the number 420, that's linked to just a holiday on 420 when a lot of people like to smoke marijuana, and you see 420 commonly on hats, t-shirts, any type of marijuana product. It's a common thing. Another common number is 710, and that's for July 10th. 710 flipped upside down spells the word oil, and the marijuana industry has deemed July 10th as a holiday to smoke the THC oil. So once again, if you see 710 on a shirt, on a hat, on a sock, on any product like that, those are key indicators that that is related to some type of marijuana reference. Doesn't mean the student or the person's using it, but it's just to be aware. I sat in a classroom one time with an elementary student, and the student had these socks on. And for anybody else that doesn't work in the field of prevention, the socks look cute. It was a smiley face, but it was a smiley face that was dripping. It was like their face was melting. And I knew what that was a reference of. It's a drug reference to LSD and tripping. But when I asked that elementary student, I said, hey, what's going on your socks? Do you know what's happening? And the kid just said, oh, it's just a smiley face. And the parent had bought these socks for the kid. In reality, that was a drug reference. So being aware of 420 and 710 as basic drug references. This is another product. There's so many of these different colors and products that exist in these vape shops. They're sold legally as paraphernalia to be used to vape anything but the illegal substance of THC. And this is just a dab device where it heats up the THC concentrates like wax or butter. The last thing I want to share with you, and this one is something that I'm not going to get into detail about with CBD oil, but this is an example of a mango CBD pod that can be put into these pre-made devices like a Juul or any other type of pod-based device. Now, not to say specifically CBD, but there are THC pods that exist out there illegally through the black market that teens are able to put into their Juul device. So just because you see a Juul, don't always assume that it's nicotine being inhaled in there. All right, so I know that was a lot, and there's a lot to talk about, like I said, when it comes to marijuana, but I really want to wrap up the final section here of prescription pills. We're seeing an opioid and stimulant epidemic, and it's continuing to rise year after year here in South Carolina. And we're seeing fatal and non-fatal overdoses skyrocket right now during this COVID epidemic. So I want to talk to you about some things that we can do as parents to be aware of, and just being in the know of what's going on here in our community. So I share this picture in the middle that shows the 3 most commonly abused drug classes among our youth, and they are the opioids, the depressants, and the stimulants. Common opioids are your Oxycontins, Roxy, Vicodin, hydrocodone. Common depressants that our youth are getting their hands on or sharing with their peers is Xanax, Valium. And then the stimulants is something like Adderall and Ritalin that we're seeing them share with each other. But what's our youth data showing? There is hope. There's good hope right now. Our youth data is showing in the past 30 days, 7th, 9th, and 11th graders really are not reporting use of any type of prescription or medication abuse. And this is great. That means our teachers, our parents, our grandparents, our friends, people are getting the message out here to our youth, and they're getting out the message that there are risks and addiction and consequences related to some of their choices and actions. And so it's great to see green across the board here. But I want to share with you the big concern that's plaguing York County and across the nation is fentanyl. And fentanyl is a high potency of an opioid. It's legally prescribed generally for excessive or extreme surgeries, post-surgery, such as an open heart surgery. Fentanyl is prescribed by physicians to people that are going through phase 3, phase 4 of chemotherapy of cancer. There's a purpose for fentanyl in this world, but there's also not a purpose when it gets mixed into substances out there. So the vial on the right-hand side shows the lethal overdose of heroin compared to fentanyl. And if you look at heroin, heroin's about 5 times as more potent than morphine. Fentanyl is about 10 times more potent than morphine, and it's more potent than heroin. And carfentanil is actually an elephant tranquilizer, and that's 100 times more potent than morphine. And if you see on the vials there, these lethal overdoses, a tiny little granular, I can't say that word, granular of salt or a little sand there is a lethal overdose. And we're seeing with fentanyl now, it's being mixed into meth. It's being mixed and cut into prescription pills, cocaine. We've seen it laced on marijuana. It's crossing all categories of drugs, and it's a big concern with overdoses that we're seeing here in York County. Specifically, York County has an issue with counterfeit pills. And what a counterfeit pill is, it's been deliberately fraud and mislabeled, and it's being cut with other substances and stamped to look identical to whatever product they're trying to market it as. So for example, in the bottom left-hand corner there, it shows a Xanax bar. And then it's kind of hard to see on the screen here, but the real compared to the fake Xanax bar looks almost identical. Top picture up there, these are stamped pressed pills that have Superman shapes. They have a leaf, a star, Heineken. I mean, you name it, these stamps are in the bottom right-hand corner, and they're used to mimic these products, and they're being cut with fentanyl. And I want to share with you, just a few months ago, our York County Drug Enforcement Unit, they confiscated through an investigation over 2 pill press machines. And like I said, this happened just a few months ago. Through the confiscation of these 2 pill press machines that were producing these counterfeit fake pills, they had 4.5 grams of what believed to be fentanyl being manufactured. And just so that you guys are aware, 4 milligrams, so the lethal dose basically of fentanyl is 2 milligrams, whereas this was 4 milligrams that they had confiscated out of our community here in York County. And that's really enough to kill up to 250,000 people. So these products are potent. Just touching fentanyl on the skin, inhaling it can put somebody into a lethal, fatal, or a non-fatal overdose. So it's so important to be aware of what's going on. And I talked about these pill press machines. The top left-hand corner shows an examples that our cartels are moving and lacing these heroin products, meth products, Percocet, Xanax, Oxy, using these fake stamp molds through these pill press machines, and nobody is realizing what they're consuming. And back in July, we had a bad batch of Roxy's that caused a batch of non-fatal overdoses skyrocket here in York County, and it was all linked back to fentanyl. And if we look from just January of 2020 to June of 2020, 69% of the fatal overdoses that our coroner office classified through their fatality reports were linked back to fentanyl. So it goes to show that these products are being shared, whether it's a friend sharing it with each other, they're being purchased from somebody. These products, nobody knows what's in it. You can't see the fentanyl, so there's heavy concern with that. Time is kind of ticking quick, so I want to quickly move along and talk about cough syrup. This is something that we're starting to see go through a trend. Trends come and go, and we're starting to see this more common. We've heard middle school students talk about cough syrup, and a lot of the music through our rap industry talks about codeine. It talks about scissor, the purple drank, and these are just slang terms. Lean is a slang term for mixing codeine or cough syrup into some type of fruity drink with soda. Sometimes Jolly Ranchers are put into the drinks, and it's causing, it can cause lethal death. It causes hallucinations. The body goes through shock, respiratory distress. It's something that we're seeing an upward trend right now among our youth. And cough medicine is something that is so readily around in cabinets. So I encourage parents, please lock up medication. This next one became a huge TikTok trend, and it's still trending as I speak. And it started on TikTok with the Benadryl challenge. Once again, like cough medicine, it's found commonly in the community. Teens are overdosing on Benadryl, and the videos are showing that the kids are trying to take excessive amounts of Benadryl to create a hallucination, and it's leading to hospitalizations. So once again, keeping these basic medications locked up out of the hands so our kids don't get access to it. Now, what I don't have to show and tell are products for how to hide heroin, meth, or pills. But these are some examples of basic ways that we see through book bags, chapsticks, Sharpies, and pens that anybody can cut out, create ways to store medications and pills into these devices. Now, I know we're moving quick, but the last thing I want to share, you guys, is seeing signs of drug use in teen years should prompt parents to seek help. And you got to know what to look for. And these are aggressive and unusual behaviors. A change in hygiene. Hygiene's getting worse. Their appearance is changing for the worse. They're not taking care of themselves. You're starting to see school, athletic, or work problems. You're starting to see money missing. They're asking for more money. They have a different friend group. That's not always a common sign, but if that friend group's linked to substance use or making risky behaviors, that's a warning sign right there. And then increased secrecy and privacy. At Keystone, you can call us at 803-324-1800. We have confidential assessments right now virtually, and you can go to our website at keystoneyork.org to get more help. This is the last thing I'm going to leave up on the screen as I let Dr. Turner finish up our presentation today, but I want to share and remind you guys that there are resources out here, starting with Keystone's website. Go to our community resources. We offer Narcan. Narcan can reverse an overdose and help revive somebody that's withgoing an opioid overdose. We offer it for free, no questions asked. We also offer something called doTERRA bags, which are a safe way to get rid of unused and expired medication. We have resource wallet cards with hotline numbers to treatment, mental health, and to a crisis text line. So I'll leave this up on here, and I thank you again for your time, and thank you so much, Rock Hill School District, on behalf of Keystone for having us talk, and thank you, Dr. Turner and Dr. Frost.
And thank you, Alex. That was amazing and eye-opening. I have seen the presentations a couple of times, and it's always upgraded, and there's always something new, and your presentation is just phenomenal. So thank you, and we are so fortunate to have Keystone and you and all of your team as part of Rock Hill and York County. So as a reminder, our Parent Academy sessions are free and open to our Rock Hill community. Tune in to the Rock Hill Schools YouTube channel for live stream, or visit later. Watch on demand for your smartphone, tablets, or laptop, or the YouTube app on any internet-enabled smart TV. All presentations will air live from 6 o'clock to 7 o'clock on the advertised date. So thank you, Alex, and thank everyone in our Rock Hill community for watching this evening. And we will see you soon. Stay well.